Welcome, everyone. Thank you for taking the time to attend HSCPOA's webinar, Marking the Milestone, 1 year of PSW registration with HSCPOA in Ontario. We're proud to acknowledge this significant milestone and highlight what HSCPOA has been doing over the past year to establish effective oversight, regulation, and accountability for PSWs in Ontario. My name is Trevor Lee, and I'm the HSCPOA's Chief Executive Officer. Since assuming my role in June of this year, I've been continually impressed by the dedication of many in support of advancing HSCPOA's public protection mandate and impact. Our collaborative approach with Ontario's PSW system partners will continue while we raise awareness about HSCPOA. We have built and will continue to build a deep understanding of the vital role PSWs play in Ontario's healthcare system and the role that HSCPOA plays towards public trust for HSCPOA registered PSWs in Ontario. I'm joined on this webinar by our team and colleagues at HSCPOA to ensure a smooth webinar process and to help answer questions. We have Lisa Gibson, Communications Manager, Daniel Jansen, Complaints Investigations Manager, Connie Campbell, Operations Consultant, Calvin Charles, and Shalini Hardawar from the registration team who handle most of the day-to-day applications, and my co-presenter, Deborah Cohen, Registration Manager. Before we begin the webinar, I'd like to share HSCPOA's land acknowledgement. The Health and Supportive Care Providers Oversight Authority acknowledges with respect that there are at least 46 treaties and other agreements that cover the territory now called Ontario. We are grateful that we can work and live in these territories. We're thankful for the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and who continue to contribute to the strength of Ontario and to all communities across the province. May we live with respect on this land and live in peace and friendship with all of its diverse peoples. This presentation will cover the following: an overview of HSCPOA, registration pathways and statistics, our achievements, lessons learned, and what does success look like? And then we will have questions at the end, and we encourage you to participate in your questions. Deborah Cohen, our HSCPOA's registration manager, and I will tag team the presentation today. And we welcome your questions, and we'll answer those at the end of the webinar. You can ask your questions through the webinar Q&A feature. Please don't use the chat. And you can also raise your hand during the Q&A portion. Note that your mics have been muted and cameras disabled. If you wish to ask questions verbally, you can enable your mic, and you will need to unmute yourself to speak. Here's a short video on the overview of HSCPOA and its regulatory framework.
The Health and Supportive Care Providers Oversight Authority was created by the Government of Ontario to support public protection. As a PSW, by registering with HSCPOA, you demonstrate to your employers and care recipients that you will deliver safe, quality care. Your registration with HSCPOA now helps shape the future direction of PSW regulation in Ontario. HSCPOA's role is to register qualified PSWs and hold them accountable for providing safe, quality, ethical care to Ontarians in their homes, hospitals, long-term care and retirement facilities, or other environments. Our work includes establishing consistency in education and skills-based requirements, maintaining an online public register for access to information about Ontario's HSCPOA registered PSWs, ensuring registered PSWs adhere to HSCPOA's Code of Ethics, addressing complaints through a fair and transparent process, and overseeing disciplinary action, all while authorizing qualified and registered PSWs to use the HSCPOA PSW visual mark, which enhances trust in the work that registered PSWs do. HSCPOA's oversight inspires public confidence that registered PSWs will deliver safe, competent, ethical, quality care in Ontario. To learn more, visit hscpoa.com/public.
Under the Health and Supportive Care Providers Oversight Authority Act 2021, a new innovative regulatory approach is being implemented by the Ontario government for the oversight of individuals providing health and supportive care services in Ontario, beginning with personal support workers, or PSWs. This model of regulatory oversight is similar, yet somewhat different from health regulatory colleges in Ontario. You can view the HSCPOA Act and the regulations under the Act by going to the Government of Ontario's e-laws site You can search e-laws in your browser and go to ontario.ca/laws. These are 9 regulations and laws under the HSCPOA Act 2021 that give HSCPOA its marching orders to carry out its work. As you saw from the video, our overarching mandate of HSCPOA is public protection. HSCPOA will oversee registered PSWs to ensure delivery of safe, quality, ethical, and accountable care. I'll now turn it over to Deborah Cohen, our registrations manager, for the next slide.
Okay. Thank you, Trevor. And thanks everyone for being here today. As you may have heard, we are actually beginning with a voluntary approach to registration. And the Ministry of Health's decision about making registration with HSCPOA voluntary was a deliberate decision to ensure that there were no disruptions to the healthcare system and the PSW supply in Ontario. There is still great value in having a voluntary approach, and it eases the sector into the registration with HSCPOA. In the future, we do anticipate that it will become mandatory for PSWs to register with HSCPOA. This will be a decision by the Ministry of Health. It's not a HSCPOA decision, but one that would be made by the ministry. We are hearing from the sector that PSWs and employers and educators alike, they want regulation. And so currently there are no fees to apply for registration and to apply and become registered. And should there be fees in the future, this will be done based on Ministry of Health decision-making, kept as low as possible, and there will be a consultation. So we are aware that in Ontario, there were 2 previous registry attempts for personal support workers. And what is fundamentally different for HSCPOA is that we are more than just a registry. We actually have the legislative framework or oversight of a regulatory body, very similar to many of the other regulated health professionals that PSWs are working with, such as physicians, nurses, dietitians, physiotherapists, etc. And so this is really what the biggest difference is. And so our legislative framework that Trevor outlined indicates our requirements. Many of you here today may come from the healthcare world and certainly from even regulatory bodies themselves. So we wanted just to outline some of the differences between the other health regulatory bodies in Ontario and HSCPOA. So PSWs are first. It's possible that based on Ministry of Health decision-making, additional providers may be added under HSCPOA's oversight. We are beginning again with a voluntary approach and that there are currently no fees to become registered. HSCPOA has a visual mark that all registrants may have access to once they become registered. And the purpose of the visual mark is to help easily identify to recipients of care, colleagues, and others that the PSW is registered with HSCPOA and is held accountable for safe care. There's no protected title for PSW and no defined scope of practice in the legislation. Much of what a PSW does is in the public domain, and there may be some exceptions where a PSW is trained and has a delegation of authority to perform either full or partial controlled acts where the client's need arises. The PSW Board of Directors is made up of competency-based appointments and appointments through the Ministry of, through the government, and this ensures that there is always a public lens at the board level and in its decision making. However, there is a recognition that the PSW sector itself plays a very valuable role in the work that HSCPOA does. And so there is a PSW advisory committee that is outlined in regulation that advises and makes recommendations to the board and HSCPOA's CEO. This committee is made up of broad PSW sector representation, including PSWs themselves, educators, employers, union representatives, associations, and recipients of care. So we're now going to go into some of the registration pathway information. And before we get started, and I have a video to show, we just wanted to emphasize that quality care is the cornerstone of our healthcare system, and that PSWs themselves play a very critical role, and so they are valued members of Ontario's healthcare system. So we will now show a short video that outlines the pathways to registration.
Are you a personal support worker in Ontario? You can apply for registration with HSCPOA, the new oversight body for registered PSWs in Ontario. Why register with HSCPOA? Trust, respect, and accountability. By registering, you demonstrate to employers and care recipients that you will deliver safe, quality care. And your registration with HSCPOA now helps shape the future direction of PSW regulation. Plus, you'll earn the right to use the HSCPOA PSW visual mark, a symbol of your dedication to safe and ethical care. Join other PSWs who take pride in being regulated and are recognized as trusted health and supportive care providers. The easy online application process guides you every step of the way. Whether you've completed Ontario PSW education, gained skills through work experience, or moved from another province or country, there is a registration pathway for you. Path 1. If you've completed a PSW education program that meets the Ontario Ministry of Colleges and Universities requirements on or after July 1st, 2014, submit your certificate or diploma and transcript. Path 2. If you've worked as a PSW in Ontario in the last 3 years, provide employment confirmation and proof of hours worked, or a combination of employment confirmation and PSW training. Path 3. If you're currently registered on a healthcare aide or continuing care assistant registry in another Canadian province, transfer your credentials with a letter of standing. Path 4. Competency assessment. This is for applicants with no Ontario PSW work experience within the past 3 years who obtained their education abroad or in Canada outside Ontario and not currently on a Canadian personal care registry. No matter your registration pathway, you'll also submit your ID, proof of language proficiency if required, and a criminal record check. Currently, there's no cost to apply. HSCPOA registration is voluntary and free. Registering with HSCPOA helps you stand out and build trust with employers and those you care for. To learn more, visit hscpoa.com/applicants.
Okay. So we have an easy online application process where people can learn more through the Apply Now button from our homepage banner and find out what application pathway is the right pathway for them. If someone's ready to apply, they set up a profile by clicking on PSW login, and they can set up a profile and apply online. So as the video outlined, we have the 4 pathways to registration. And under the path 4, our competency assessment, we also have a recognition of nurses and midwives policy, because we do actually know that there are many internationally educated nurses who train often as nurses and midwives who are working as PSWs in Ontario today. And we wanted to ensure that these individuals had a mechanism to become registered should they wish to do so. So I won't go through all of the pathways because the video covered this, but I just did want to touch upon path 2. Now, path 2 is what's called our legacy pathway, and this is the pathway that is time limited and closes on December 1st, 2027. So just to give a little bit more information about path 2 is that this includes PSWs who have been employed in Ontario in the past 3 years. And the purpose of Path 2 is to value and recognize those PSWs that have been working in Ontario's healthcare system. So there's 2 options under Path 2. The option of experience only, or those trained on the job that are very highly skilled and competent PSWs and may have decades of experience on the job. The second option is a option for people who trained before July 1st, 2014. And they actually completed their education and training before that date that they're eligible to apply through our Path 1. And there is the option for those individuals. So their education would be recognized. Again, this pathway is only open until December 1st of 2027. What is required under Path 2 is that there is an employer confirmation required to confirm employment and that the PSW has a set of skills that would be expected of a PSW graduate of a education program on or after July 1st, 2014. The employer completes a form and they must be on what fall under the category of a prescribed employer list, which includes hospitals and long-term care homes, retirement homes, and many home care agencies. There is a gap in private agencies that hire PSWs for private home care, for example. And we are working with the Ministry of Health to determine solutions on how those individuals employed with private staffing agencies can become registered. What Path 2 requires is, because it is time limited, that these individuals eligible through Path 2 must become registered and remain registered by December 1st, 2027. The Fixing Long-Term Care Act is another piece of legislation that impacts registration with HSCPOA, because what it entails is there's a regulation, Section 52, under the Fixing Long-Term Care Act, that outlines the qualifications for PSWs. And so under this particular piece of legislation, there is a requirement for a PSW who works in a long-term care home to meet the qualifications, which include either registration with HSCPOA, eligibility for registration, meaning they don't become registered, but they are eligible under one of the pathways that we have in place, or that there are limited exceptions outlined in the regulation. So if a PSW or equivalent, because again, there's no title protection, who is working in a long-term care facility is only eligible to apply for registration through Path 2, then they must become registered and remain registered as a PSW before the closure of Path 2 on December 1st, 2027. The reason is that because a PSW will no longer be eligible for registration once Path 2 closes. So currently, any PSW who's working in long-term care, they don't have to go back to school and upskill, because they can become registered. Most of those individuals working now can become registered with HSCPOA in long-term care. It's only after that December 1st closure date where there may be a requirement. So we always say that, we recommend that homes and go to either the Ministry of Long-Term Care for information and assistance, or their legal counsel about the Fixing Long-Term Care Act regulation. Now, to give you an overview of our registration stats to date, is that we have been registering PSWs now for the past year, when our regulations took effect on December 1st of 2024. So we're just over the year mark. And we have just, I think now it's just shy, because this was done, these stats were taken a couple hours ago. We have just under 7,500 PSW registrants who have voluntarily become registered with HSCPOA. A majority of them are coming in through Path 1, or the Ontario PSW education, on or after July 1st, 2014. And then the remaining, third are coming in through our employed pathway, and then to a smaller extent, the recognition of nurses, as well as our labor mobility and competency assessment pathway. Our registration statistics also provide information about the employment sector where a PSW reportedly is employed. So you'll see on the slide that there are a number of PSWs who work in the home and community care sector who are registered with us, and long-term care homes and hospitals, and to a lesser extent, staffing agencies and retirement homes. we do anticipate in the future that there's likely a much larger percentage of PSWs working in long-term care that we will see become registered with HSCPOA, because we are aware that in the long-term care sector alone, that there's upwards of 50,000 PSWs working in Ontario. So we have a lot of work to do. We are not certainly very mindful of that, but we are up for that challenge. So one last thing that I'll tell you about the registration area before I hand it back over to Trevor is that for annual renewal, we will actually be going through our first annual renewal next year. So it will be due March 31st, 2026. Certificates of registration are going to expire on April the 1st, unless they are renewed or there's an extension that's granted. And all PSWs will be, our renewal portal will open no later than February 1st of 2026. Thereafter, all certificates of registration, much like other regulatory bodies in Ontario, they will actually be issued, and they will be issued for a one-year period. So our annual period of our certificates of registration is from April 1st until March 31st. Renewal includes updating information in your profile to make sure everything is up to date with HSCPOA, and answering questions for the Ministry of Health's Health Professions database. And this is a reporting requirement for HSCPOA as well as many other health regulatory bodies in Ontario. So there is no criminal record requirement for renewal. So if you're registered with HSCPOA and you maintain your registration and you renew, you do not have to submit an annual criminal record check, but there will be declaration questions that are asked. So currently there are no fees to renew registration, and in the future, we will be implementing our continuous quality improvement program once the regulation is passed by the Ministry of Health, and that may require some continuing education for PSWs registered with HSCPOA. We don't have anything in place right now that we're requiring for renewal. And this program will be developed once the regulation is passed, and we will be consulting with the sector on the development of this program and what would be appropriate for PSW registrants. Okay, so now I'm going to hand it back over to Trevor to talk about the next section of our presentation.
Thank you, Deborah. So the board has done extensive work to develop its governance policies and processes and its strategic framework. So as you saw from the slide early in the presentation, we've registered just under the 7,500 PSWs to date using our online user-friendly application process that strives to reduce barriers for applicants. Resources have been developed to distribute information about HSCPOA to the broad PSW sector in Ontario, reaching PSWs, employers, educators, etc. This includes building website content for applicants, registrants, employers, and the public, including a fair and transparent complaints and investigations process that was helpful FAQs, frequently asked questions, for registrants and the public. HSCPOA has developed downloadable and printable info sheets, videos, and social media. We've built and maintained relationships with system partners and engaged with the PSW sector, including employers, educators, PSWs themselves, associations, unions, other regulators, and the Ministry of Health, the Ministry of Long-Term Care, and the Ministry of Colleges and Universities. We have attended many meetings with the PSW sector and have delivered several presentations virtually and in person at meetings and conferences. So the next slides will provide a few highlights of our resources. We've developed our strategic framework, which includes our vision, critical and operational outcomes, strategic pillars, shared values, and how we'll monitor our work for accountability. HSCPOA has several educational videos to assist with the information distribution about the regulatory framework. This includes information about how HSCPOA assesses the registrant requirements for PSW education and skills-based qualifications. the Public Register of PSWs, and the HSCPOA PSW visual mark. There are also videos about HSCPOA's Code of Ethics and the standardized, fair, and transparent complaints process. There are 10 info sheets, handouts developed and posted on the HSCPOA website to enable sharing, consistent messaging with PSW and other system partners so PSWs know what to expect. Some of the highly utilized resources include About HSCPOA, How Registering Benefits You, the PSW, HSCPOA's Code of Ethics, Why Encourage PSWs to Apply, and Why PSW Graduates Should Apply. These resources are available in English and French. We're also looking to translate some of these info sheets into other languages. A common question that arises is what's the difference between HSCPOA and PSW associations like the Ontario Personal Support Workers Association? So we've developed a resource that outlines that difference and those differences. Both HSCPOA and PSW associations have a role to play in Ontario's healthcare system. The oversight body versus the association information sheet published on our website outlines the differences between associations and an oversight organizational regulatory body. As required in regulation, we've convened the PSW Advisory Committee, as mentioned earlier by Deborah, which is made up of a broad representation from the sector, including PSWs themselves, for HSCPOA to keep informed. The committee allows HSCPOA to keep a pulse on the sector and provide advice and recommendations to HSCPOA's board and CEO about matters impacting PSWs in Ontario. We've worked with employers to provide support, including access to the employer directory for employers to easily download and report on the PSWs working within their organization who are registered with HSCPOA versus looking each PSW employee up individually on the public register itself. We've also established a streamlined process for employers to more efficiently provide the required information about PSW employees eligible for registration through Path 2, employed as a PSW in Ontario, and as Deborah referenced, as our commonly referenced legacy pathway. HSCPOA frequently presents to employers and their PSW employees to help build understanding about HSCPOA and the pathways to registration. Great effort has been made to establish a fair and transparent complaints process with helpful information on our complaints process on our website, including FAQs for the public and for registrants. We have and will continue to collect and report on data about the number of PSWs who apply and become registered with HSCPOA, including timelines and efforts HSCPOA has made to enable user-friendly and efficient application processes for PSWs in Ontario. Relationship management with the sector partners has and continues to be a fundamental aspect of our success. We are listening and learning, and this is a key to build a bit buy-in of all of our partners, including PSWs, employers, educators, unions, and associations. Our goal is to spread accurate and consistent messaging. We understand the impacts of the previous PSW registry attempts and how there still may be a perception that HSCPOA is just another registry. But as noted earlier in the presentation, we are more than just a registry. We are an oversight regulatory body in the public interest, and we are now formed and supported by governing legislation. We're continuously myth-busting to communicate accurate information, simply and clearly. The Ministry's intention of Path 2 is to recognize and value the PSWs in Ontario's workforce and enable these individuals to become registered PSWs with HSCPOA. As we have come to learn through an increased engagement with our system partners, Path 2 does have some challenges, but we're working and liaisoning with the Ministry of Health about how we can find solutions to some of these issues that we've become aware of. Again, we're listening, learning, and we're evolving as we go. We realize that not everyone is tech savvy and may have challenges with the application process, despite it being intended to be user-friendly as possible. So we realize the overall success may only be achieved by a mandatory registration for PSW in Ontario. Change can be hard, and it takes time. Being open to change can result in many benefits. Above all, PSW registration with HSCPOA is a good thing for the public and all within Ontario's healthcare system. Public protection. HSCPOA fulfills its mandate of public protection by ensuring registered PSWs provide safe, quality, and ethical care. There is public trust and confidence in the care received by HSCPOA registered PSWs. HSCPOA is committed to fair and transparent processes in all of our work. We will work with our legislative authority and organizational policies so that all PSWs in Ontario have a pathway to become registered with HSCPOA. PSWs recognize the benefits of HSCPOA registration as demonstrated of their commitment to deliver safe, quality, ethical, and accountable care. We will liaise with the Ministry of Health about any decision-making situations surrounding mandatory registration with HSCPOA and encourage advance notice. HSCPOA will strive to provide effective oversight of PSWs in the public interest and also for public protection using a right or light touch regulatory approach. Our regulatory actions are proportionate to the level of risk to the public. Registrants are accountable to HSCPOA for safe care, and as a PSW registrant, they understand what is meant to be regulated, including completion of annual renewal. And as Deborah referenced, our annual renewal will be commencing and will have its first sequence of the next session starting April 1st of 2026. We also have before the Ministry of Health our continuous quality improvement regulation, and once it's passed, we'll develop the program and consult broadly with the system partners in the program's development. We'll implement a PSW advisory program to provide support and resources to HSCPOA registered PSWs to meet their obligations. The overarching goal that PSWs are trusted, accountable, and valued members of Ontario's healthcare system, which is all a very good thing. We have a call to action for Ontario healthcare system partners. Encourage PSWs to apply and become registered. Help inspire others and raise awareness. Convey the benefits to PSW registration with HSCPOA. Share HSCPOA's resources and promotional content, our information sheets, our frequently asked questions, guides, and videos. HSCPOA would be happy to review the draft content, including information about HSCPOA, to ensure the latest consistent messaging is being used. So please reach out to us. We're available and we're here to help. Focus on social media and share videos via YouTube and posts published on Facebook or LinkedIn. Contact HSCPOA for answers to any of your questions. Thank you. Please feel free to connect with us via email with any questions. You're also encouraged to view any of our website content for any additional promotional information. And with that, I'm going to ask you to please subscribe to HSCPOA's news to receive timely information. You can also do that by visiting hscpoa.com and scroll into the bottom of the homepage to sign up for our newsletter or scan this QR code that is currently on the slide. Please also follow us on our social media platforms, Facebook, LinkedIn, and YouTube. So it's time for us to move to our question and answer period. So I'm going to ask Daniel Jansen, Lisa Gibson, and also Deborah is already on screen with us, and Connie Campbell may wish to join us as well. These are our senior leadership team members, and we will try our very best to address any questions that you may have. So Daniel, I'll turn it over to you as you are our master of question and answer ceremonies.
Okay, perfect. Thank you, Trevor. Thank you, Deb. So the first question is for you, Trevor. There are quite a few questions asking if the slides will be shared.
So the slides will not be shared in their content, but we are making this webinar public, which will have the slides within the webinar content. So in some ways they are going to be shared in that form, but not as a separate downloadable section.
Perfect. And then, Deb, we have a few questions around the criminal record checks and the difference between the criminal record check and the vulnerable services check. So a few were asking, why is the criminal record check required versus a VSSC? And they've also noted that the FLTCA requires a vulnerable sector check. So why would HSCPOA not do the same?
Mm-hmm. Yeah, we actually accept both. So if someone has a valid criminal record check, by valid we say within 12 months of the date of application with HSCPOA, they can actually submit either a vulnerable sector check if they have one, or a criminal record and judicial matters check. HSCPOA requires a criminal record and judicial matters check if they don't have an existing check. And the reason why we've opted for the CRJM check is that it reduces barriers for applicants. A criminal record and judicial matters check is easier to access. It can be done online in many cases. There are shorter wait times, and HSCPOA has also partnered with a criminal record check provider where an applicant can do a criminal record check through the application form. Criminal record checks, if you don't have a valid one, that is one fee that would be incurred by an applicant, and we have negotiated a low rate with Certain, our criminal record check partner provider, and that is at $23.60. And we know that if you were to go into a police station and do a check, they're anywhere between $40 to $70 from what we hear.
Okay. Perfect. And then just one more question about that. They're asking, do the criminal record checks need to be dated within a certain time frame? Like, are they eligible only for, they're dated for a certain amount of time? Yeah.
Exactly. So 12 months is the criminal record check validity date. So from the date that the applicant applies for registration or submits their application to HSCPOA.
Perfect. Devin, and another question for you surrounding the pathways to registration. So are all pathways accepted by the Ministry of Long-Term Care? Or is it just still pathway 1?
Oh yeah, all 4 pathways, including our recognition of nurses and midwives policy, are ways in which a PSW can become registered with HSCPOA. So all of the registration pathways are eligible for registration. They're outlined in our registration regulation. And once somebody is registered with HSCPOA through one of the permitted pathways, then everyone is created equal, and you are a registrant who has demonstrated accountability for safe, ethical, and competent care. And they're held to the HSCPOA's Code of Ethics.
Great. So I'm not sure if this is for Deb or Trevor, or maybe the both of you want to make an attempt at this. So what is the role the Ministry of Colleges and Universities is playing in HSCPOA?
I'll let Deb take a start with that question.
Sure, yeah. So the Ministry of Colleges and Universities of Ontario, I think it's called MCURES, Research Excellence and Security, is actually the organization or the government body that created the PSW standards. And those PSW standards are what all of the recognized education programs in Ontario abide by in their education curriculum. And so that's the role that the Ministry of Colleges and Universities plays, is that we use the MCU's standards as sort of the education requirement for PSW registration.
Okay, great. Trevor, the next one I think I'll pose to you is, will registration with HSCPOA ever become mandatory?
That's a great question. The legislation speaks to 2 events. One, the creation of the voluntary registry process, and it does give reference that in the future, through ministry legislative changes, mandatory registration may be the pathway that they take, but we are all subject to the legislative changes that will be required to transition from our current voluntary registration system into the mandatory registration system.
Okay, great. And I guess maybe I'll throw the next one to you as well. Trevor, is there a working group to discuss annual fees?
So annual fees. The legislation also contemplates 3 fee items. Let me put it in that context. The first item would be that the organization would be funded by the ministry, which is currently the situation that we're currently in with the voluntary registration process. The next in the fee setting discussion is that there would be a hybrid or a proportionately funded system between the province and the registrants. And the third option is a fully registrant funded organizational oversight authority. But all of that is subject to legislation which has yet to be finalized. So there is indications within the available resources of the legislation and memorandum of understanding that it is contemplated on those 3 areas. But there is an overarching principle that the ministry has been very specific in identifying, and that is that the intent is not to put undue financial hardship onto the sector, which could disrupt the very valued services that PSWs provide in Ontario's healthcare system. So I just wanted to highlight that there is an overall intent statement that the ministry has stated, in addition to those three possible variants.
Great. Deb, I think I'll throw this one to you. So this individual states, some companies are requiring NAC registration to hire. How will HSCPOA assist registered PSWs?
So in our legislation, in our registration regulation, we actually recognize PSW education or work experience. And in regards to PSW education, it is the recognition of a PSW education program from a NAC program or a private career college. Many of them are under NAC, or the National Association of Career Colleges. We also recognize programs that train PSWs from district school board programs in Ontario, the Colleges of Applied Arts and Technology, and Indigenous institutions. So if someone has completed any one of a PSW program that's recognized under one of those four categories of education institutions, then they would be eligible for registration. And so there isn't a preference for one program under NAC over another. If you have completed a program and you meet the registration requirements, you become registered, and then, you are accountable and registered just like any other registrant with HSCPOA.
Okay. Deb, I think I'll throw this one to you as well. So will HSCPOA be developing new education, or will you be partnering with organizations that are already delivering training?
Yeah, so our continuing education requirements are not yet in place. That program is yet to be established. But what we will be doing as a regulatory body is to ensure that all of our registrants, as they're held accountable to the Code of Ethics for safe, ethical, and competent care, that they are aware of their requirements or what it means to be, a regulated PSW. And so what are their obligations? So we will be developing resources to help aid in that understanding. We already have developed some modules about, what it is to work as a regulated PSW in Ontario. And in the future, we would likely be developing our continuous quality improvement program that does recognize education that's completed from a number of institutions that exist out there, because we are very aware that there are many organizations that are right now currently providing valuable education for PSWs to keep their knowledge and skills and competence up to date. So, there'll probably be a combination of both, that a PSW can do some existing educational resources that are out there, and HSCPOA will be developing our own in collaboration, in some cases, with other resources that are out there.
Thank you, Deb. Trevor, I think I'll pose this question to you. There's a few questions about this. How have unions responded to HSCPOA's work?
Interesting question. So we would like to find a way to work collaboratively with unions and their expressions of concerns on behalf of their union members. That being said, I like to break it down to the common denominator. A union's members are PSWs functioning in Ontario, not unlike a non-unionized PSW working in Ontario. And our collective effort is to ensure that everyone is providing, as Deborah's referenced, the safe, ethical, and accountable care levels. And we want to do the best we can to protect the PSW's identity in the province for the services that they provide. And I think that's best served by working as collaboratively as we can with unions towards ensuring the protection of their members and our valued PSWs in the province of Ontario. So I think I would invite any unions that may be on this call to contact us. We would certainly want to have conversations with you about maybe doing some of the myth busting around the aspects of our organization's existence and how we can work collaboratively, respecting one another's difference of intent. But certainly we have foundationally PSWs in Ontario as our baseline care and consideration. So thank you for that question.
Okay, great. Deb, this one will be for you. What have you been hearing with regards to barriers to registration, and how can they be addressed by employers,
Great.
if any?
So yeah, I think, there's some misunderstanding out there and confusion, and that is naturally going to be the case because this is so new for the sector. And I think that's actually the beauty of a voluntary approach that the Ministry of Health, is taking, is that it eases the PSW sector into building its understanding of what oversight and regulation is all about. So education, and confusion, or trying to myth bust out there, is key. I think there are also, some challenges with the PSWs just, not quite being sure or fearful of what does it mean to be registered with HSCPOA. So really just trying to clarify information there. There is some, challenges with organizations and not having the union support, as Trevor had mentioned. And so we're really just trying to work with all system partners, including the unions, to clarify information out there. I think one of the challenges is the perception of path to being fair. Why is it mandatory, as it sort of is outlined now, because it has an end date and the other pathways are not. And again, as Trevor mentioned, we're trying to work with the ministry on sort of, trying to figure out solutions to that. But one of the, key things is that, I think some of it could be that in the future, if it's mandatory, that would be very helpful for sort of to level the playing field. And so again, not a HSCPOA decision, but a Ministry of Health decision. There are many employers that have made it mandatory for PSWs to be registered, to maintain employment, or to become newly employed with their organization. And that was a policy decision by the employer. So we're not implying that this is something that all employers have to do, at least right now with a voluntary approach. And so really what we're trying to do is get accurate information out there and assist all system partners, including employers and the PSWs themselves. And so please know that we're here to answer your questions. We're here to provide information and share resources and even present to organizations upon request, because we really are trying to get the word out and have accurate information spread.
Perfect. I think this next one will be for you as well, Deb. There's a few questions surrounding how certain individuals would apply to HSCPOA. So particular, this individual is asking PSWs that work for private agencies, and also could resident support aides apply to HSCPOA? And then I can repeat this for you, but this last one kind of groups in as well. Is there a date for PSWs that are formally trained as nurses to register by? So a few different kind of questions surrounding qualifications and which path.
Right. So if a PSW was educated on or after July 1st, 2014, they can come in through Path 1, and there's that ability in the private setting where somebody can become registered. Currently, if someone is eligible through Path 2 and they work for a private agency or work in a private home as a PSW, unfortunately, there isn't the ability for that particular private employer to sign the form, because the whole purpose of having an employer as a prescribed employer for Path to sign the employer form confirmation is that the individual who signs the form has a set of skills that can actually attest to the PSW skill set that they are, safe and competent. And so it's possible that, a private, individual or family member or friend doesn't necessarily have those skill sets. So what we're trying to do with the Ministry of Health is to remedy that and find solutions so that those particular PSWs do have a mechanism under which they can become registered. So that answers that first question, I hope. And then the second one about the resident support workers. So that refers to some titles in long-term care facilities. And what we actually are most concerned with at HSCPOA is not that the title of PSW is where the current PSW works, but that the individual has a set of skills that would be expected of a PSW that meets the requirements for the Ministry of Colleges and Universities to graduate a PSW from a recognized program, is that if somebody is in the resident support personnel role and they do actually have a set of skills of a PSW, just that they're in a role that's titled differently, then the employer can provide that confirmation through signing the form, and that individual could become registered as a PSW. Again, there's no title protection in our legislation. And then the final question about the internationally educated nurses, is that correct, Daniel? Do I have that?
Correct. Yeah, correct. Yeah.
So that one is that there is no time limitation on that particular pathway. So if someone is eligible for registration under our recognition of nurses and midwives policy, and again, we have included nurses and midwives there because we know internationally often the title of the education program and the title of their professional designation is nurse and midwife. So that's why the two are included, is that these individuals can come in and become registered as long as they meet the criteria outlined in the policy, and there are no time limitations to that.
Perfect. Thank you, Deb. I think I'll give you a little bit of a break and throw the next one to Trevor. So Trevor, if staff ask their employer, what are the benefits of HSCPOA registration? What would you say? So what are the benefits to becoming a HSCPOA registered PSW?
So I would say for me, HSCPOA registrant status implies a qualification that separates their skills and their achievements from non-registrants. It also ensures that in the event that we have complaints and or investigations, and we may address a question in that regard before we end the webinar possibly, is that we are focused on ensuring the integrity of PSWs working in Ontario. So if a PSW is registered, they are committing to a code of ethics, they're committing to a code of conduct, they're committing to the delivery of safe care and accountable care and ethical care in the province, and that separates those individuals from those who are not. That doesn't mean and should not be inferred that the ones who are not registered are any less. It just is an opportunity for those to become registered and to become part of that regulatory oversight. As we move forward in the future with more registrants coming in, we will also be ensuring the protection of the PSW's level of work. Although there is no title protection, it still is by reference of the services that they provide, by investigating and holding accountable individuals who are not upholding those same levels of accountability, ethical, and safe and quality care that are being delivered by HSCPOA registrants. So for us, it is really elevating the level of commitment and the oversight towards individuals who may not necessarily be meeting that level of expectation. And again, through the complaints and investigation process, we want to change some behaviors if those are occurring towards improvements, which does overall serve the public protection, which is the mandate of HSCPOA. So thanks for that question. I think it's one that we face. It also indicates an area where, as covered by some of the answers that Deborah has shared, some employers are actually, by their own decisions, making HSCPOA registrant status one of their pre-qualifications for considerations of employment. And that is their choosing, and I'm not in any way offended by their choice. Every employer has an obligation to make the choices to their practices that seem and are deemed relevant by themselves for their businesses. But, for example, long-term care facilities are required to have HSCPOA registrants or eligible for registration individuals with HSCPOA. They may choose to make HSCPOA registration part of their baseline. And that also then means that individuals who are part of our registration process and are registrants within the register now have career opportunities that are not afforded to them if they're not registered. So those are just some of the nuances of the sector and how HSCPOA can be best to support individuals as they move through their career choices.
Perfect. Thank you, Trevor. So yeah, the next question is actually for me. It's a perfect segue. So what do I do if I have a complaint made against me? So just a note, as part of the legislation established by the provincial government, the HSCPOA Act and its regulations, it was also mandated that there be a complaints mechanism in place to protect the public interest. So as such, our complaints protocols and processes were set up to align with the ministry's requirements outlined in the HSCPOA Act. So we do anticipate that the majority of registrants will provide safe, quality, and ethical health and supportive care services that align with the requirements in our Code of Ethics. However, if a complaint is received about you, HSCPOA will send you a notification letter and a copy of the complaint within 14 days of receipt of the complaint. We'll also send you a fact sheet that outlines the process of complaints in a clear and easy to understand language. You will then have 30 days to provide a written response to HSCPOA. And is it important to note that no decisions will be made about that complaint until HSCPOA has received your response or until you've had repeated opportunities to do so. So we'd follow up with you to make sure that you've received the complaint and then to get your response. And then following that, HSCPOA's CEO may ask for additional information from you or the complainant. That's the individual who submitted the complaint. And then once all relevant information is received, HSCPOA's CEO will then carefully review all of the gathered information about the complaint and make a decision using a risk-based framework. So we do recognize that there is some apprehension from registrants, from PSWs with regards to complaints, but despite our primary mandate being public protection, I'd also want to highlight the fact that just because we receive a complaint does not mean that there will be a decision that negatively impacts you, the registrant. The point is that our complaints processes will be open, fair, and transparent. And as noted, both you and the complainant, the registrant, excuse me, and the complainant will be very actively involved in the process. And we do have, as Trevor's already noted this, but we do have extensive FAQs on our website as well for both the public and for registrants, or PSWs, that answer a lot of these questions about the complaints process. So the next question here, let's see. Yeah, so we've touched on this with regards to some employers making it mandatory. Deb, I'll throw this one to you. What will continuing education look like? And if so, is there a cost?
Yeah, at this point in time, we're unable to answer that question because that regulation has yet to be passed and the program has not been developed. So that will come in time, likely in a very consultative way in its development, because we want to hear from the sector on what would be the right approach for PSWs. So I guess it's to come.
Okay. And then Deb, this one's for you as well. Is HSCPOA verifying completion of approved education of a registrant? So that what you see in the application is HSCPOA approving that and verifying, sorry, excuse me.
Yep.
Verifying that it's accurate.
Mm-hmm. Yes, we are.
Okay. Getting to the end. I think we've covered most of them. Deb, just quickly one more. How does Path Forward work with regards to competency? And is there a standardized test or assessment?
Yeah, so we have a substantial equivalence process right now that examines previous education in comparison to the Ministry of Colleges and Universities PSW standards that all education programs in Ontario are held accountable for the curriculum. And so that's a comparison analysis. We are also working in the future to develop more of a online competency-based assessment that really assesses currently what a PSW knows and can do, but that is something to come in the future.
I think that covers most of them. So I just see we have like 2 minutes left. I think Trevor, I'll throw it back over to you to conclude.
Okay. Well, thank you. We are just shy of our 1 hour of our milestone acknowledgement. I want to thank all of the individuals who've joined on to our webinar. I'd like to also thank my colleagues for putting the effort into structuring this webinar, participating in this webinar. And I think the last kind of thoughtful consideration I would want to share is thank you to all the PSWs in the province of Ontario, that the work that you do each and every single day to support healthcare in our province. It's not unrecognized. It certainly is a part of the fabric of our healthcare system. And I know that our intentions are genuine, that we want to support, appreciate, and acknowledge the many PSWs for the work that you do to continue Ontario's healthcare system moving forward. That's the reason why it was created as an organization, and that we're committed to ensuring the public protection and the public safety. And we look forward to working with all of you through the remainder of this registration process. And also for those of you who are registrants, thank you for being a registrant of HSCPOA. And we look forward to engaging with you as we move through our first renewal, as well as moving into further developments like the continuous quality improvement initiative and the educational requirements and all the things that are yet to come. But thank you so much for your time this afternoon, and have a very safe afternoon. Okay, thank you. Bye.